Alright guys, today we're going to be talking about pharm terms. And the reason why we want to do this is if you can understand what these terms mean, when you're reading the drug insert and they're going to talk about onset, peak, duration, and so on, you'll be able to understand what they're trying to tell you. So today I brought a special helper, my daughter, and she's going to tell me what sound effects I should have in our video today.
Snake, bear, cat, dog, zoo.
Alright, so I have to figure out how I'm going to talk about snakes and deal with the slide. So what we have is we're talking about onset, absorption, and minimal dose. So let's say that you have a snake and you're working at the zoo and so on, and you want to figure out how fast am I going to put the snake asleep so I can work on him or move him from one cage to the next. So what's going to happen? Well, I'm going to give the snake the drug, but if that drug doesn't get into his system, that snake's never going to fall asleep, right? That's not going to be safe to go into that cage and work on that animal. So what I need is the drug to get absorbed. So I give the snake the medicine, and the amount of drug is getting higher and higher into that snake's system. Now, all that takes time, right? I give the snake medicine right now and instantly the snake falls asleep. It only works that way on television. It doesn't work that way in reality, right? So it's going to take a time for enough of that medicine to get absorbed to hit the minimal treatment dose, right? Once I hit this orange line in here, the drug level is high enough to put the snake asleep. So I can move the snake from one cage to the next or do surgery or whatever it is that I need to do on the snake. So I got to figure out how I'm going to talk about a lion and seal and deal with distribution. So let's say that I give a lion a drug and a seal a drug, right? So what happens is, as you said, the drug got absorbed into the system, but that drug is going to move and go to different places in a seal versus a lion. So for example, some drugs really like the fat. And so a seal has tons of body fat, and so the drug is going to go into the body fat a lot easier in a seal, and so less of that drug is going to go to the brain, the liver, the kidneys, because the seal has so much fat compared to a lion. Lions don't have anywhere near the amount of body fat, and so the drug is going to be distributed, it's going to be moved very different in a lion versus a seal. So my baby girl wants to know about a bear. So let's talk about the maximum dose. So what happens is I take this drug and the level goes up and up and up and up and up, right? Once I pass this orange line, right, I now am getting the effect of the drug. And so now the drug is working more, but as I approach this maximum line, either the effect of that drug is going to max out, right? So for example, let's say it was Tylenol, I could take 2 tablets of Tylenol and my headache is going to be as good as it's going to get, right? Or what can also happen, let's say I take more than that, and yeah, you might get more headache relief, but you're going to have side effects. You're going to have adverse events. For example, it can fry your liver. Now, some of these side effects are going to be very, very important depending on the circumstance. So let's say I'm dealing with a bear, it's going to be a major problem if this medication has a side effect or an adverse event of making the bear grouchy, right? That's not so good there. And so you're going to have a lot more side effects as you approach that maximum dose, especially if you exceed it, right? So very important to pay attention to that. And that's why they set that upper limit. Hey, you aren't taking any more Tylenol, ibuprofen, or whatever, because you got too much risk, right? You're going to have too much side effects, too many problems compared to the amount of benefit that you're getting. All right. And so every person and every animal is different. So one of the things we have is a therapeutic index. So what is the difference between the minimal dose and the maximum dose? And that's going to be kind of put into a ratio, right? It's the heal to kill ratio. So if 1 pill makes me better and 2 pills kill me, I have a therapeutic index of 2. And so, for example, going back to that bear, I don't want to use drugs that have a small heal to kill index, right? So I got the bear, I made him fall asleep, I'm sanding off his toes, and now he gets a little too much medicine in his system. Oh no, right? There's a major problem here. Same idea with people. If it's over-the-counter medication, we want it to have a very large therapeutic index, right? You take one pill to make you better, but 60 pills makes you sick or puts you in the hospital. That's fine because, you're not going to be taking 60 pills unless you're trying to cause a problem. All right. Now, pills that have a narrow therapeutic index, right? So one pill makes you better, but 1.2 pills makes you sick. Okay, we got a problem here, right? That we're only going to use those drugs under heavy supervision. So, for example, in the hospital, we could check the levels of lithium. So we know exactly how much is in your system before we give you more. And so very, very difficult to give medicine in those situations. All right, so on this slide, I'm going to be talking about half-life, metabolism, and excretion.
And dogs.
All right, and dogs. All right, so let's say that you give your dog some medication, and what happens? The drug level in the blood goes up, 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 right? Let's say it's Benadryl, right? Well, why does Fluffy ever wake up, right? Well, what happens is the Benadryl will put him to sleep, but what will happen is slowly but surely, the dog will start breaking down the Benadryl. So his liver will break it down, his kidneys will pee it out, and so you can see the amount of Benadryl in the system is going down, 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 down. And then when it gets below the minimal effective dose, it's not going to work anymore, right? When he loses about half the dose, right, that's what's called the half-life. Now, dogs metabolize things very differently than people. So, for example, you can eat chocolate, it's not a problem.
I don't like you. I don't like you at all.
Why? Because chocolate has a chemical called theobromide in it. And so your theobromide level goes up and very quickly down, 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 and you're totally fine. But for a dog, it doesn't work that way. So the theobromide level goes up and very slowly drops down. And eats more chocolate, it goes up, and now the dog is overdosed on theobromides. And so that's why you don't give your dogs dark chocolate. So how long do medications last for? Well, that's called duration. And so it's the time from onset to the time of offset, right? And that's going to be determined by a couple of things. Number one, what is the minimal therapeutic dose, right? As long as you're above that line, you're going to be responding to the medication, right? We're going to see that, yes, this drug is in your system. The other thing is how much medicine did you take, right? If you need 20 milligrams in your system and you only took 30, right, it's not going to take very long for you to get below that 20. The other thing is how much did you absorb, right? So if you took 100 milligrams but only 10 got in your system, it's not going to do anything for you. Right? And then the last factor that we're going to be looking at is going to be metabolism and excretion. So if I took 100 milligrams, right, it all gets absorbed into my system, and I have a very short half-life, it's going to quickly get out of my system, and I'm going to have a pretty short duration. Versus if I have a long half-life, it's going to stay in my system a lot longer. This is why the elderly, they get smaller doses less often, because they have much longer half-lives for drugs because they're just not as good at breaking down the drugs or peeing them out. All right, so the next thing we're talking about is indications, right? This is why you should take this drug. This is what the drug is officially approved for. All right, now off-label use, right? It's a good idea to take this drug for that thing, but it's not FDA approved. Right? In order to be FDA approved, you have to do drug studies and spend all this money. And kind of what the FDA is trying to figure out is what are the risks of taking the drug for this condition versus what is the benefits. And so does the risk outweigh the benefit, or does the benefit outweigh the risk? Now sometimes they discover uses for drugs that the drug was not approved for. And so let's say, for example, cats. They often take a dewormer called febendazole. Well, one of the things they've discovered is that actually has benefits in treating cancers. There's actually been a few people that have taken febendazole to treat their cancers. Now, whether or not that's a good idea, I don't know. But that would be an example of an off-label use, right? Febendazole is not FDA approved to treat cancer. Now, let's say in 10 years, 20 years, whatever, the FDA says, yeah, this is a really good idea. We approve febendazole to treat cancer. Now, taking febendazole for cancer would be an indication. It would no longer be off-label because the FDA has approved it for that. All right, so next we're talking about contraindications. All right, so contraindication is kind of like this man riding a bicycle. Just don't do it, right? I cannot imagine a circumstance in which riding your bicycle while it being attached to a plane that's taking off, the benefit of riding really fast is going to outweigh the risk, right? You'll probably end up killing or seriously hurting this guy, right? It's just not worth that risk. So now a precaution is, you can do it, but it's risky. And so you only want to do this if the benefit outweighs the risk. So a contraindication is like, no, don't you ever do this. It will never make sense. The benefit will never outweigh the risk, right? A precaution is, okay, time out. You could do this, but you really got to think about it. There has to be a really good reason that you're going to do this. Very rarely are the benefits going to outweigh the risk, but they might. But you got to be extra careful here. And so that's going to be the major difference between the contraindications and precautions. All right, that concludes today's episode. If you liked what you heard, be sure to click the subscribe and like button down below. And as always, if you have any questions, comments, concerns, or if there's any particular topic you'd like me to create a video on, let me know in the comments down below. All right, well, I look forward to seeing you on my next podcast.